Hi guys, welcome back to my channel. So today's video is going to be a little bit different. Today's video is about the coronavirus. As we all know, this outbreak has induced a lot of fear in people, and there's been a lot of misconception flying around regarding this virus. So as a healthcare worker and a registered nurse who is board certified, I feel like I should contribute to this to clear some of the air, to provide some education to people. Now, disclaimer, this video is simply for educational purposes and should not in any way form the basis of your healthcare decision. If you feel like you've been exposed to this virus, or you feel like you're having symptoms related to the flu, please by all means contact your healthcare provider as soon as possible and ask if they have available tests to see if for some reason you're exposed or you have this virus. Real quick, every information that I'm providing to you guys is information that I've thoroughly researched, and I have got this information from credible sources such as the CDC and the World Health Organization. So I have done my research and I'm providing you with information that is accurate and information that is truthful. But please, by all means, do your own research. Go ahead and go to the CDC website, to the World Health Organization website, and find out for yourself. Okay, so without further ado, let's jump right into this video. So before I even go into this video, I want to clarify some things. What is a virus? A virus is an infectious agent that survives within a living host. A living host can be a plant, it can be an animal, it can be another bacteria, it can be another virus. Some viruses are natural to certain microorganisms, like I already mentioned. So if there happens to be a change in the way this virus survives within a living host, then a disease outbreak can occur, which can possibly explain what's happening with the coronavirus. Apparently, it is believed that the coronavirus started in Wuhan, China, which it is true. It started from a wholesale market that sells wild animals such as bats and other animals in China. However, nobody knows the true origin, where this virus actually started from. Now, there have been cases whereby people who were not in any way related to the Chinese market were exposed or were confirmed positive for this test. So that tells us that in as much as a big chunk of this outbreak started from this wholesale market in China, nobody really knows the true origin of this virus. So what are some of the signs and symptoms that a person who might likely have been exposed to this virus might exhibit? Like I already mentioned, sneezing, coughing, upper respiratory infections, signs and symptoms such as sore throat, runny nose. Some people might experience diarrhea. In more severe cases, some people might experience pneumonia, multiple organ damage, or even death. Now, researchers have told us that the elderly, are more at risk for contracting this virus, which means that people with pre-existing condition, it can be a young person, it can be an older person, people who have chronic medical conditions such as hypertension or diabetes or cardiovascular diseases, they are most at risk for contracting or even possibly dying from this virus. Now, it doesn't mean that a healthy person cannot contract or possibly be infected or die from this, but these are the class of people that are most at risk. So what are some of the things that anybody can do to protect ourselves? According to the CDC recommendation, these are the following that people can do to better protect themselves. The first thing is to practice good personal hygiene. Wash your hands thoroughly for at least 20 seconds regularly. You wanna, if for some reason you don't have available water or soap at any point in time, you wanna sanitize your hand with sanitizer that contains at least 60% ethanol. You wanna cover your cough or your sneeze if you're coughing. You can cough inside the crook of your elbow like this. So that is a more appropriate way. If you happen to have a tissue paper, you can sneeze or cough inside it and immediately discard it into a garbage container. Please do not have your waste laying around. It's okay to not want to shake people at this time. It's totally understandable. You can elbow them. That's totally fine. Avoid non-essential travel to areas that have this outbreak. Like if your travel is just for fun or leisure, it's okay to want to suspend it and go at a more appropriate time. It's okay to social distance. I mean, it's okay if someone is sneezing, please by all means stay at a distance from them, because this virus spreads by droplets, respiratory droplets. So when a person coughs or sneezes or from mucus from the nose, if those particles are suspended in the air or they drop in surfaces such as a table or a doorknob or anywhere, and you touch those places and you touch your nose or your mouth, your eyes, that is the best way to contract. So guys, if you feel sick, please stay at home and self-quarantine, just so there is less likelihood of passing it along to other people or family members. Now let's jump right into some of the myths that I hear people talking about. The first myth that I've heard people say is that this virus was created by a human being. That is absolutely not true. Like I already mentioned, some viruses are natural to certain life forms such as plants or animals or even another bacteria. For example, the COVID-19 virus, it predominantly infects or is predominantly natural to bats. If there happens to be a change in the way this virus acts or grows or multiplies within these natural forms, then a disease outbreak can occur. So it is likely to explain why the COVID-19 virus came about. So I don't think that anybody or any nation actually intentionally propagated this virus for the sake of just destroying an entire country or world or whatever. So the second myth that I heard about is that when you wear a face mask or a surgical mask, you can protect yourself. While a person who is infected with the virus already can protect other people from getting the virus, wearing a mask does not necessarily protect a healthy person from contracting the virus. Now, people who work in healthcare, like healthcare workers, they wear a fitted N95 mask. Now, this mask, they fit so snugly such that there is no space between your skin and the mask. So there is actually no way for particles to seep into those masks. Now, the masks that everyday people are wearing, these are just common masks, common surgical masks that they are not tightly snug. There are still crevices that these particles can get in, and you can breathe it in, you can touch your face. As a matter of fact, researchers have shown that wearing this mask can actually predispose you to even more infection, because now you're adjusting your glasses or you're touching your face and you're touching this mask and all those particles are just embedded within the mask. You are at even much greater risk of contracting this virus and spreading it to other people. Now, the third misconception that I've heard is bathing with garlic or salt water can help prevent this. There is definitely no harm in trying that, but honestly, there is no scientific backup to show that bathing in garlic or salt water can prevent you from getting this virus. Now, CDC recommendation, like already mentioned, wash your hands, be safe, social distancing, non-essential travel. Those are some of the proven ways that people can better protect themselves from contracting this virus. Remember, this is probably myth number 4. It's that cold temperature or very hot temperature can kill the virus. There has not been any scientific backup to show that being in the cold weather or hot weather can kill the virus. This virus can thrive in every area. The most reliable ways to better protect yourself from this virus is, like I said, practicing good respiratory hygiene, covering your cough, social distancing, non-essential travel, cancellation, and all those different things. Those are proven ways by the CDC. Another myth that I've heard is that adding chlorine to your water or pouring a bunch of ethanol in your water can kill this virus. While you're recommended to wash your hands or sanitize your hands with at least 60% alcohol, you should not go about making your own hand sanitizers and mixing a bunch of alcohol and garlic and salt water and chlorine and all of these different harmful ingredients. As a matter of fact, you are predisposing yourself to even more danger. Okay, so one other myth that I heard is that getting a package from China can predispose a person to getting the COVID-19 virus. Now, there is no scientific backup, like I keep saying. These are all myths. And this virus is unlikely to survive for very long periods of time. Now, this virus can be suspended in the air. They can probably survive for a couple hours, but a packet from China is very unlikely that the virus will survive that very long time to the point of causing any disease. So I hope that this video helps you, and I hope that you are better able to educate yourself based on this video, so that when you tell people about this, you're giving them the proper information. Now, like I already mentioned, the information I provided is from credible sources such as the CDC and the World Health Organization. Feel free to do your own research. Knowledge is power. Let all propagate good information, and I hope you all have a safe day. Bye-bye.